Good evening, everyone. Thank you for joining me to learn about PWSA USA's newest initiative, Rarely Missed Opportunities, your PWS Financial Guide. Financial literacy and well-being are vital to our overall health. Nowhere is this more critical than in the rare disease community. Overall financial health is defined as the dynamic relationship of one's financial and economic resources, or lack thereof, as they are applied to or impact the state of physical, mental, and social well-being. Only 57% of adults in the United States are financially literate, according to a recent CNBC survey. Add to this the stress and burden of being a lifelong caregiver for an individual with a rare and complex disorder such as Prader-Willi syndrome, and that is a much lower number. According to an analysis from JPMorgan Chase, a majority of families in the United States, roughly 2/3, do not have enough money saved in an emergency fund. In June, PWSA conducted a financial literacy survey. I'd like to share with you some of the results that we found throughout this survey. Respondents indicated that there was a lack of familiarity or competence in navigating through health insurance, including state coverage and supplemental insurance. They lacked a familiarity or confidence in securing state and federal benefits, such as Katie Beckett waivers, state waivers, Social Security, and the appeal process that often coincides with those applications. They had a fear of high costs of medications and treatments for their loved one. They lacked an awareness of cost-saving and local resources that often are available to assist. For example, free diapers after the age of 3, respite reimbursement, mileage reimbursement, early intervention services, and long-term care support. Additional concerns noted in the survey included the impact of frequent absences, work disruption, and/or hospitalization on work ability to maintain a level of employment. The impact of a reduced work schedule or early retirement on household financials. The burden of cost of a multi-generational cohabilitation and lack of affordable local outpatient and residential care options for individuals with Prader-Willi syndrome. Current and future debt. Planning for the needs of their other children, such as college and marriage, and any other health concerns that they may have. Projected future concerns about long-term needs and care of their loved one with Prader-Willi syndrome. A fear of diminished resources for their own retirement. 89% of PWS caregivers have not had to navigate the state of federal benefits eligibility and application process prior to becoming a parent or a guardian to an individual with Prader-Willi syndrome. And since PWS presents as a spectrum diagnosis with symptoms that continue to unfold well into adulthood, there's not consistency in presentation or presumption of eligibility for services or financial benefits from state to state. Those who apply for support are denied and are not aware that the system is designed to deny as a default, and that oftentimes appeals are necessary. With or without a child diagnosed with Prader-Willi syndrome, there's a stigma associated with applying for various forms of assistance, and that can stand in the way for many people who need the financial safety net that these benefits can provide them. Many caregivers who are having to navigate through insurance, benefits, social services, and more are doing so for the very first time. Most hospital social workers are unfamiliar with the needs of those with Prader-Willi syndrome and are ill-equipped to help new parents navigate these systems. Additionally, the stress and strain as a result of lack of paid maternal or paternal leave in the United States also puts newly diagnosed families at a financial disadvantage. Add to that a monthly NICU stay and an exhaustive number of follow-up appointments with specialists throughout that first year, and there's a tremendous impact on a family's financial security. For this reason, PWSA, with the funding from an incredibly generous grant from Global Genes Global Advocacy Alliance, has created a rarely missed opportunities, your PWS financial guide. It's a web page that includes waivers by state, several downloadable documents, and 2 video presentations by financial planners familiar with the challenges in the PWS community. Waivers allow states to provide services to individuals with ID, DD, as well as other vulnerable populations such as respite, community rehabilitation, day programs, residential placement, and more at no cost to the family. What I'd like to do now is share my screen and show you how to navigate this kit. So when you go to the PWSA USA website, this top bar where it says resources, in that drop down, right here is rarely missed. You're going to click on that and it's going to bring you to the webpage, Rarely Missed Opportunities, your PWS Financial Guide. And here what you'll find is the United States map. You'll click on your state of choice. For this, I'm going to click on Iowa. And what you find here when you click on that is the enrollment is automatic. So it's going to tell you about the Medicaid and the SSI determination. It's going to tell you what kind of waiver programs they offer for individuals with Prader-Willi syndrome. Now, in most of these states, it's not going to say it's a PWS waiver. It's going to say something such as individuals with intellectual or developmental disabilities or other health impairments. Some states will actually say rare diseases. So for Iowa, the Home and Community-Based Services Intellectual Disabilities Waiver is the waiver that they offer. And that waiver covers services such as adult daycare, consumer-directed attendant care, day habilitation, home and vehicle modifications. Now, what I'd like to stress about this is each state is able to choose which services that they offer through their waiver. So this is not going to be the same state by state. Some states are going to offer more than just this HCBS waiver. So it's important that you check out what is in your state. It's going to tell you whether or not there are crisis services available or waiting lists. So for Iowa, if you are in a crisis, you may get priority placement on the waiver. Now, it's important to remember here that your definition of a crisis may not be the same as the person evaluating whether or not you're in a crisis. So when we are applying for waivers and we are in a crisis, it's important that we distinguish all of those challenges. This is an area where we don't like to share sometimes the struggles that we're facing when our child may be experiencing some unsafe, aggressive behaviors, or you're no longer physically capable of maintaining a safe environment. Be sure that you include that information when you're applying for these waivers. It's important that those evaluating see the bigger picture. Income limits. You must be determined eligible for Medicaid. Members may be Medicaid eligible prior to assessing waiver services or determined eligible through the application process. So again, this is something that varies from state to state. Some states, you are eligible for Medicaid waivers based on disability only, as well as Medicaid. And in other states, it is income-based. So be sure to check your states to know. We've included the phone number to contact the Medicaid Customer Service Center, as well as the website where you can learn more about your state's waiver services. I'd like to very quickly just thank Tula, who has collected all of this information for us. She did contact every state, looked into all of the resources. She did a tremendous amount of work to make this happen. So thank you, Kim. Now, to go back to the state, if you're looking to move, we often get many calls about moving to different states and what does the waiver process look like? Will I automatically be eligible when I move to another state? By including the map of all of the states, you have the opportunity to look at what waiver services are available in other states. And I encourage you to do that before you relocate somewhere. We've included 2 presentations, the first being Financial Management and Special Needs Trust This was presented by Vailo Grigoriev, who is a parent of a child with Prader-Willi syndrome, and we're so grateful for his presentation and sharing his information with us. I encourage you to either watch it here or check it out on our YouTube channel. It is located in both places. The second presentation is the 7 key steps to financial planning for special needs families. And this was presented by Patrick McGrath, who is also a financial needs planner. And although he does not have a loved one with Prader-Willi syndrome, he's very familiar with the PWS community and has been actively involved in that community for many, many years now. We've also included some downloadable documents. The first one is on ABLE accounts. And I'd just like to share that there are ABLE accounts in almost all states now. They are a little bit different state by state, and this document is going to tell you a little bit about that. The second is Family and Medical Leave Act. So we often get questions about whether or not the diagnosis of Prader-Willi syndrome qualifies families to apply for the Family and Medical Leave Act. And it does. PWS meets that definition and the care that you have to provide for your loved one with PWS. I do want to say, though, many people are not aware that not all businesses have to offer FMLA to their employees. So the company has to have 50 employees and more to legally have to provide that. Now, that does not mean that it's not that your company won't offer this, but legally, if they have 50 employers and more, they do have to. Social Security disability. We created this document in conjunction with a staff from the Social Security Administration office. And in that discussion, we did learn that very often, really the majority of the time, your initial application for Social Security is going to be declined. And there's many, many reasons that happens, but most often the reason in the Prader-Willi syndrome community is people are just not familiar with Prader-Willi syndrome, and therefore we need to explain how PWS meets the federal definition of a disability. And this document gives you many, many links where you can take a look at those. And if you need to appeal, please reach out to us. Our family support team participates in appeals for Social Security weekly. We're happy to help with that. Now, the caveat with Social Security is this is income-based only. Therefore, prior to your loved one with Prader-Willi syndrome turning 18, this will be based on a family income. So if your income is above the threshold as a family, you are automatically going to be denied, and they're going to encourage you to reach out and apply again when your loved one turns 18. At that point, it will be their income only. And then the last document is about early intervention and why this is important and how this will help decrease costs for you as a family. Again, I'd like to thank the Global Genes Global Advocacy Alliance for their grant funding that allowed us to put this program together. I'd like to open it up for questions now. So the first question we have here is, why do people get denied Social Security? So this happens for 2 reasons. Very often, it's because the person reviewing the application is unsure how Prader-Willi syndrome meets the federal definition of a disability, and why many people with Prader-Willi syndrome are unable to be gainfully employed. So the federal definition of a developmental disability found in the Developmental Disabilities Assistance in Bill of Rights Act says that the term developmental disability means a severe chronic disability of individuals 5 years of age or older. It is attributable to mental or physical impairments, is manifested before the individual attains the age 22, is likely to continue indefinitely, and results in substantial functional limitations in 3 or more of the following areas of life activities. And those life activities are self-care, receptive and expressive language, learning, mobility, self-direction, capacity for independent living, and economic self-sufficiency, as well as reflects the individual's need for a combination of sequence of special, interdisciplinary, or generic services, supports, or other assistance that is a lifelong or extended duration and is individually planned and coordinated except that such term, when applied to infants and young children, means individuals from birth to age 5, inclusive, who have substantial developmental delay or specific congenital or acquired conditions with a high probability of resulting in developmental disabilities if services are not provided. So based on this, individuals diagnosed with Prader-Willi syndrome qualify as having a developmental disability. However, it's also important to remember that many people with disabilities are able to work. And that's what's important to Social Security. So once we determine that it meets the definition of a federal disability, now we need to include in that application why your loved one with PWS is unable to work and to be gainfully employed. And those requirements include certain dollar amounts, being able to work without supervision, that sort of thing. And as we know, many people with Prader-Willi syndrome have difficulty in these settings that do not have the support that you guys have been providing their whole lives. That food security is not in place. The support that you provide to help them be productive and to remain calm and on task. Without that support, they're unable to keep their jobs in many situations. So outlining those reasons are the reasons that you want to put in that application. Additionally, PWSA has been working with the Prader-Willi California Foundation to have Prader-Willi syndrome added to the compassionate allowance list. And this would allow individuals with Prader-Willi syndrome who apply for SSI, if it gets added, to automatically be approved based on the definition. So the compassionate allowance list has a listing. It's a listing of many different disabilities that automatically qualify somebody for Social Security. And our hope is that we can have Prader-Willi syndrome added to that. The next question is, how do I find an attorney who specializes in Social Security to help with my appeal? So honestly, I would just Google Social Security attorneys in your area and then do your homework. Research each of those names that comes up. Additionally, PWSA can help you with that appeal process. So please feel free to contact us at 941-312-0400 and ask to speak with any of the family support counselors. We can help you in that appeal process. How do I apply for Medicaid? Okay, so this is going to vary from state to state. Some states, Medicaid is determined solely based on your income. And in other states, there's other criteria. For example, in New York, it is not just solely income-based. So here you would apply through your local Department of Social Services based on having a disability. What should you include in your application? Again, it's going to vary from state to state, but for those states that are just based solely on income, it's going to be your income. They're going to want copies of your pay stubs or perhaps last year's tax records. For states that do not make this determination based solely on income, you're going to want to include any documentation or assessments that show in writing that your child has Prader-Willi syndrome, as well as any other disabilities that they may be diagnosed with. Would it be possible for PWSA to put together a written guide with long-term care solutions? This is a great question. Thank you. This is something we're actually working on. Long-term care is going to look different for everyone, and that's great. Everybody is different. Every person with Prader-Willi syndrome is unique. Their needs are going to be different long-term. What many of you already know is there's a shortage of residential care placements that specialize in Prader-Willi syndrome. And over the last few years, we've seen families getting more and more creative in how to meet their loved ones' needs. Some families are using self-direction funds to fund staffing in a home that's already been purchased. Others are using different types of services. So things like perhaps HUD placement, HUD housing, so that the rent is cheaper, and then using their SSI to pay the living expenses and using waiver services to cover staffing. There's lots of different ways that we can do this. We do have a residential provider work group that has been broken up into 3 different subcategories. And one of those subcategories is that transition from school to adult services, and what does that look like? What are the options for your loved one once they are out of school? What does the adult world look like for them? And that's going to include all of this housing. So yes, I think it's a great question, and putting a book together or some sort of written guide is going to be super helpful. You're struggling with getting pitolisant covered by insurance. Are there programs to help cover these expenses? Off the top of my head, I'm not sure. I would suggest contacting Harmony Biosciences to see if they have a bridge program that's similar to Pfizer's program for growth hormone. I believe that until pitolisant is FDA approved for children, it's probably going to be a struggle to have additional funding available to help cover these costs. We are doing a PT intensive similar to Napa. They mentioned they accept grants. Where can I get one? Oh, that's great. I didn't realize that they accepted grants. I suggest contacting your state Department of Human Services or Disability Services. Each state calls that office something a little bit different. But often they have funds set aside for things like parent training or family support services. They may have some funds set aside for this type of service. So I would check with them. Your state chapter is also a great resource. There may be people in your state who have gone this route and have been able to get grant funding to help cover these costs. So I would check there as well. When should I start a special needs trust? Well, this is a pretty personal decision. However, the sooner the better. Patrick and Viola both speak to this issue in their presentations, so be sure to check those out. I would keep in mind that you can do the legal part of setting up a special needs trust without actually funding it. You can fund it at a later date. So if you want to just be sure that you have that in place, go for it. You can do that at any time and then add the funding and the money down the road. What is enabling? Okay, so the Achieving a Better Life Act of 2014, which stands for ABLE, this allows people with disabilities to open savings accounts where they can save up to $100,000 without losing their eligibility for SSI, Medicaid, SNAP benefits. Those are things like food stamps. The funds can be used for all sorts of different things. And this is where it is a little bit different than special needs trust. So the funds within an ABLE account can be used for your living expenses, so housing, for transportation, for support services, for healthcare expenses. The area of things that you can use this money for is much broader than some of the special needs trusts. And the income that you put into an ABLE account is not taxed. However, it's important to keep in mind that the maximum amount that you can put into an ABLE account each year is $16,000. And once you reach $100,000 in the account, at that point, your other benefits like SSI are considered on hold until that account falls below the $100,000. Has PWSA had any communication or plan to have any communication with the Centers for Medicare and Medicaid Services? It's frustrating to see that the HCBS waiver is interpreted differently in each state. I love this question. So the short answer, yes. For those of you who don't know, HCBS stands for the Home and Community-Based Services Waiver. And it's a federal waiver that is implemented across the country. It's implemented in every state, but it's being interpreted differently from state to state. And there are some provisions in this waiver that can be dangerous for individuals with Prader-Willi syndrome. And the two that come to mind right away is the unlimited access to both food and money. So the idea behind the waiver is well-intentioned. It's meant to increase independence for individuals with disability, less dependency on the service system, should they be able to do well in that setting. For people with Prader-Willi syndrome, unlimited access to both food and money is detrimental. It will result in death, and that is, obviously not something that we want to see happen. The other piece of it is any restrictions that you have in place need to be faded. So again, food restrictions, locked kitchens, locks on your refrigerator or your cabinets would need to be faded under this waiver. And each state implements that a little bit differently. So several years ago, I had the opportunity to speak with the Deputy Director of CMS's long-term care program. I don't believe he's there any longer. However, he was very familiar with Prader-Willi syndrome. And when I asked the question about fading some of these restrictions around food security, he said, "Are you talking about Prader-Willi syndrome?" So he was aware right away. And when I said it was, he was adamant immediately that the medical necessity restriction around food security for Prader-Willi syndrome doesn't apply under this waiver. So he had a couple suggestions. One being any food security things that are in place should not be in a behavior plan. They should be in a nursing plan, a plan of nursing care, or safeguards rather than behavior. Behavior automatically implies that it's modifiable, and that with the right support and training, somebody is going to be able to fade those back and be successful. So that was his first thing. When I mentioned that states were interpreting this differently, regardless of what the intent was, he had said at that time that additional training would be necessary. So I would encourage, if you are experiencing this, whether it be in your home or your child, your loved one is in a residential program, reach out. We are happy to have these conversations at the state level and really do some advocacy and training around this issue. Additionally, I do want to share, I do have a meeting scheduled with somebody from CMS next week to discuss this and to see if we can partner with them on some education, not only for the states and providers within the state and the audit teams, but also for our families. So yes, it is definitely something that is on our radar and that we are continuing to try to build that relationship. Additionally, a few years ago, the Prader-Willi California Foundation did work with somebody at CMS to put together some documents that you can find on their website. They include doctor's notes and some justification for those restrictions that are medically necessary to keep somebody with Prader-Willi syndrome safe. I am not seeing any other questions. So with that, I'd like to thank the Global Genes Global Advocacy Alliance for sponsoring this project, and to all of you for participating in the survey, watching the videos, and being here with us tonight.